Today I have the honor of speaking with Stephanie Thompson. Stephanie Thompson is a contract technical writer and the president of Young Dems BCS. And you know what? Stephanie wrote a blog post. And Daniel Cohen, who is the president of Indivisible Houston, sent me a note and he said, Egberto, you have got to see this and better, you've got to have this woman on your show. To which I said, I don't think you had to tell me that. So without any further ado, Stephanie Thompson, welcome aboard Politics Done Right. How are you doing today?
Hi, I'm pretty good. Thank you for having me on, Egberto.
Well, look, I am ecstatic to have you because I tell you what, I am a person who believes in stories. And I think in order to change our system, in order to change our healthcare system, we have to have people's stories and real stories. Because what happens is at any time in life, right, or at any time, there are only a small amount of folks who are ill or in the need of healthcare. So it's sort of something that's not on their minds. But when you are the person sitting back there without healthcare and living that life knowing that what if. So what I'd like to ask you to do first of all is tell me about that blog post that you wrote and then we'll go from there.
Sure. So at first, I wasn't sure about whether I wanted to talk about this publicly on such a public forum as Facebook, because we do consider our healthcare journeys to be very personal. And then I realized, much like you just said, that personal stories are compelling. And so I decided to be open about what I've been dealing with. And certainly there are people who are dealing with far worse situations. And I can only speak to, my own experience, but it really opened my eyes to the reality that a lot of Americans are dealing with. So for the past 2 years, I have worked as a contract worker, and this is the first time in my adult life that I've ever been, employed as a contract worker. And I realized that contract work is becoming more and more popular by employers because it removes their liability to their employees, and it removes the responsibility from them to provide me with benefits, which we consider standard for a normal employee. So for the past 2 years, I've been living without health insurance because my employer didn't have to provide it to me. And so now I'm speaking very publicly about it because, we are employing more and more contract workers by the day because it's obviously good for business to, employ people that you're not obligated to in any way. This means I can't claim all kinds of things, not just health insurance. And so I was living that way. And basically my health insurance plan was to eat my vegetables, cross my fingers, and hope for the best, and if I was concerned about something, if I was sick at all, I would just wait for it to pass and not get it looked at because I wasn't sure how much it would end up costing if I did get it looked at, and I'm lucky that I'm young and that I'm, for the most part, in very good health, and I just shudder to think about going through that uninsured period if those things weren't true. If I had a pre-existing condition, if I had, a special needs child, or if I just had one procedure, because, one simple procedure can cost thousands of dollars. Even a routine examination can cost hundreds and hundreds of dollars. And, given the fact that 75% of Americans are living paycheck to paycheck, which means they don't even have $500 put aside in savings. So given that fact, uninsured people in that group, one procedure can ruin their life. One procedure can totally just destroy their world. One routine checkup, and they're probably living like me and just avoiding the doctor, which means that their health insurance plan is waiting until something is so serious that they just have to get rushed to the ER. And, and that's not a plan, because that's often when it's too late to do something about it. And this experience for me has been very eye-opening, because, I'm lucky enough that I didn't have to worry too much most of the time. But the reason I was a little bit hard to get a hold of today, and I apologize about that, is because I went in for a mammogram, and I have to go in for a biopsy on Monday.
Oh, wow.
And, I had to wait until I got health insurance to schedule an appointment, because I didn't know how much it would cost. And I felt like I detected something back in December, late December, and I decided to roll the dice and wait until my insurance card arrived to get it looked at. And I don't intend to be dramatic. It's likely not cancer, but I have to wait until Monday to be sure. And, the lady, the nurse who helped me said, try to have a good weekend, because she knew I'd be worrying about it, and she felt sorry that I'd have to wait. But what she doesn't know is that I've been waiting for months. So what's another weekend,
Stephanie, first of all, I'm sorry for the pain that you're going to have to go through this weekend, because we can tell you anything, but while you're waiting, But this is real, and this is completely unbeknownst to me, and I feel a bit that I'm putting you through this without having known this before.
No,
you are
I
a
just
brave
found out.
person for keeping up with this interview on this. Do you want to continue, or I am?
Yes, I do, because this is the real stuff. This is exactly why people should not be waiting for coverage. I think it's actually supposed to happen this way, because, I was very lucky, or so I thought, that I survived 2 years without any major problems, but the reality is that a lot of people don't survive that uninsured period. And I think people need to hear about situations like mine and other people's stories, because these are the repercussions of not having health insurance and wondering about, something to do with your health, something that is bothering you, and you are just kind of waiting until it gets so bad that you can't ignore it. And, for a while, I just told myself maybe I'm just imagining things, but I promised myself that as soon as I got coverage, I would schedule an appointment and, get it checked out. And, I just received my health insurance card, and on Monday, I went in, and then today, I had some more appointments, and I have to wait for further confirmation. I got blood work done, and again, they seem pretty confident that it's nothing, it's something, but it's likely not cancer. But
You still
we have Americans dying because they didn't crowdfund enough for life-saving surgery. And we are a wealthy country. We shouldn't have anyone dying because they didn't crowdfund enough for surgery that they needed to survive. And when you live in a wealthy country where things like that occur, your system is broken.
Wow.
And now I'm experiencing firsthand the consequences of not being covered. And I'm lucky that it's only grazing me. This is hopefully nothing, and I don't have to be too worried. But there are a lot of people who don't get such hopeful news. And, the procedure I had today alone would cost $800 if I wasn't covered. And even with coverage, actually, I got a mammogram today. And so with health insurance, if it's a routine screening, it's covered by my health insurance. But if it's a diagnostic mammogram, I pay out of pocket $800. And that's before I even get my biopsy. That's before whatever other expenses I may occur. I'm already resigned to the fact that I'm probably going to be dropping some money on this because this is probably going to end in surgery. And who knows how much that would cost without health insurance. Who knows how much it's going to cost me even though I have health insurance, and so today alone could bankrupt, a family that's just barely getting by or not even surviving, who work for minimum wage, who have more than one kid. When I was living in New York City, I worked at a network of homeless shelters, and, a common misconception is that homeless people are homeless because they don't have jobs. But working at homeless shelters, I met people who had not one full-time job, but two full-time jobs. So I think of someone like that who is working 80 hours a week and is still living in a homeless shelter. They leave their 8-hour shift at Dunkin' Donuts and go straight to their 8-hour shift at McDonald's. And, and they have kids and they can't afford daycare because we don't have universal pre-K, and these people are not lazy. They work harder than anyone.
Person, yeah.
They never see their kids because they're working 80 hours a week, and yet they still have to live in a homeless shelter because New York City is that expensive, and this affordable housing isn't just a New York City problem. This is an everywhere problem. And, so I think of people like that. And then I think of the next tier, which is poor, but not poor enough for Medicare or Medicaid. And that's a whole other problem in terms of people who are covered, because you can live a very economically disadvantaged lifestyle and, not be really surviving, definitely not thriving, and yet you still don't qualify for Medicaid because the threshold is so low, because they deliberately make it so low so that no one qualifies or very few people qualify. That's all deliberate, so The threshold, I was looking at it for 2018, the threshold for an individual was 16,700 something.
Mm-hmm.
And if you make,
Minimum wage, yeah.
16,800, you're too rich for Medicaid.
Right, right.
16,800 a year. You're too rich for Medicaid.
Amazing.
And for a family of 3, the threshold is 28,000.
Not even 3 times.
Yeah.
That is shameful. Yes.
So 28,000. If you make 29,000, even with a family of 3 to support on 28,000, then you make too much money for Medicaid.
Wow.
And granted, I'm not a healthcare professional, so some people might, dispute my breakdown or whatever.
The thing about it is the trajectory, and it is simply bad. So I gather then that you are as well supportive of Medicare for all as the
yes.
way Pramila Jayapal wrote the bill.
Yes, I'm very supportive of Medicare for all. That's, to me, one of my primary issues because of the experience I've gone through and because I know that it will impact so many people if implemented. This is an economic issue. This is a race issue. This is an everybody issue, because if we want to talk about something that can really change people's lives in a good way or a bad way, it's whether they have healthcare coverage. And, not even talking about like whether it can save their life in terms of the actual procedure, but how it can financially ruin them
right.
or save them to either have healthcare coverage or not. And, and that's why it's an economic issue. And that's why, in the interest of, caring for people who are just, struggling, like this to me is one of the primary issues in addition to ensuring a living wage. This absolutely needs to happen. Countries with far smaller economies can afford to take care of their citizens. Why can't we? We
should be able, Stephanie. Now, Stephanie, let's talk about you. I mean, you're an amazing person. Here you are with your tribulations, and you're talking about everybody else. Let's talk about you here. When I saw your post, you said you cried. When you cried tears, mostly tears of joy, when you had that card in your hand, and it's so great that you had that card now. But during your life, I mean, you're an activist as well. You're out there. How scared are you when you're driving and hoping nothing happens? How scared are you when you go on a little vacation or on the beach and hope you don't step on a spear? Tell us a little bit about that your mental state, knowing behind you that no matter what you do, you just have to be that much more careful.
Yeah. Well, I used to bike to work, actually, and that was constantly going through my head. What if someone hits me? Because I could be rushed to the ER, but what if there are, subsequent problems? I would constantly worry about that. And I would bike to work anyway, but it was always on my mind. And I had to be very careful. I, would practice a lot of kind of preventative medicine in a way, which is just like eating healthy and, working out, because that was pretty much the only thing I had in my arsenal was, just those basic ways of taking care of yourself, but other than that, I would try not to let it govern my life. But it was always there in the background. And I guess I never really realized that I had been carrying this weight around with me. It was always there with me, this dread of, what if something were to happen? What if I get sick? what if I need surgery? I haven't been to a doctor in over 2 years now, and who knows what's wrong with me, that I just can't detect yet. And, I try not to live in fear. I try not to, let it control me. But when I received that card, I was silent for a moment. And my boyfriend wondered if why I was silent and what was going on. And then I just started sobbing. And that's when I realized that I'd been carrying that weight around, and I hadn't known it until that moment that I was waiting for coverage, and that part of me would never fully be able to rest until I got covered again. And this is the first time in my adult life that I have gone without coverage, because I always had it through a job. Usually if you have some sort of office job, then you probably have decent benefits. And I had a lot of office jobs. I was working in PR departments, communications, and I just didn't ever have to worry about it. And that's why this period has been instructive for me, because I think a lot of Americans aren't really concerned with it because they've never had to worry about it personally. If they've never been self-employed, my parents are both small business owners, self-employed. So, I grew up on Medicaid, and I also saw that my dad often avoided going to the doctor. I thought he was just being stubborn, but it's also probably a financial decision, because he knew he just couldn't afford it. If they wanted to perform some sort of procedure, it's just kind of like choosing to live in willful ignorance. Because if I don't go to the doctor, they can't tell me there's something wrong with me. And, there's no problem if I don't know about it, right?
Right.
And, obviously that's how serious problems become even more serious, because they're left unaddressed. And, I'm lucky that so far my prognosis seems good. But I was waiting, and while I was waiting, my problem was becoming bigger, both literally and figuratively.
Yeah.
And, so no one should have to wait it out like that. No one should have to roll the dice with their own health and well-being. And, I did think about going to the doctor anyway, no matter how much it cost me. And even if it wipes out my savings, then so be it, and maybe if I would have had to wait even longer, I would eventually have done that. But because I knew it was coming pretty soon, I just decided to wait. But, I'm lucky that as the problem got worse, it wasn't something even more serious.
Right, and that is on the Affordable Care Act product that you have, the insurance plan that you have.
So I'm not covered through the ACA, and that's a whole other thing, because I could have opted into that, but when I looked at paying for my own coverage, it would have cost me hundreds per month. And, we have pulled ourselves out of housing insecurity. And at the time, I just decided that I needed that money to, improve my situation.
Absolutely. Now, but the coverage that you have now is through your employer.
It's through my employer, yeah.
Gotcha.
And I'm lucky that now it's a very good plan, and that's great. But there are still lots of people who aren't so lucky, and that's why I have to consider the situation of others, because I'm lucky that my luck has recently improved. Yeah, but we have thousands of Americans without coverage, and the ACA was kind of a compromise, because if I'm being totally honest, I consider it mandated health insurance, which is not the same as universal health care coverage. And, that's why I opted out, because it would still cost me hundreds per month. And I also had the option of opting into COBRA, which is
ridiculously high.
Basically nothing.
Right.
So, and again, it was a financially motivated decision, and I decided that I'd rather keep that money. And I'm young, I'm healthy, it's fine, and so I kept just rolling the dice like that. And I know a lot of other young people have done the same, and that's kind of what they counted on when they removed the individual mandate.
Right.
They counted on people like me opting out. And for me, it was, I had to at the time. And it killed me, because I knew that this is exactly what they wanted, but I also do believe that the ACA wasn't enough for that reason.
Not at all.
And that's why we can't let people who accept money from healthcare, health insurance industry donors to create something and call it Medicare for all, when in fact it's not. And that's something that I'm going to be paying attention to as the never-ending 2020 primary season continues. Is that I'm going to be paying attention to whether the candidates, when they say Medicare for all, do they actually mean Medicare for all, or do they just want to use it for political points? And then when you look at it, it's actually just Medicare for some, because some of them, it might end up that they just expand the age groups that are covered, which doesn't solve the problem, and that's not universal health care.
Right.
So, I'm definitely going to be paying attention to, what they actually mean when they say Medicare for all or universal health care.
Well, Stephanie, I wanted to hear your story. Your story is amazing. Thank you for keeping this up in as much as you had that information today. So what I want to ask, is give me a 2-line closer so that every millennial, every Gen Xer, every Gen Z can listen to and know.
I want them to know that healthcare is a human right. And in a wealthy country such as ours, I believe that you can't consider yourself a patriot if you're okay with fellow Americans dying when they don't need to. And the only thing that is standing in our way is greed. There are no other reasons to not have universal health care. The only thing standing in our way is greed.
Stephanie Thompson, thank you so kindly for this interview. Thank you so kindly for telling this story. I guarantee this story means a lot to America all over. Thank you so kindly.
Thank you, Alberto.